Most people think that aging and disease are synonymous. The truth is, as we age, there is damage to our bodies, but the amount of damage that we're experiencing could be sped up or slowed down or potentially even reversed. In this video, I'm going to explain what really drives the aging process at a cellular level, and I'll show you how lifestyle and therapies like hyperbaric oxygen can make a measurable difference in the aging process for you. I'm Dr. Jason Saunders, and after more than 20 years in clinical practice and a PhD in molecular biology with a focus in regenerative medicine, I want to give you a practical, science-based perspective on the aging process and disease. Especially over the last 50 or 60 years, people are absolutely living longer. Life expectancy today is well into the upper 70s and mid 80s, and centenarians, those living 100 years or more, are one of the largest growing populations from a percentage perspective. That being said, while we're seeing massive increases in longevity, we're not seeing massive changes in quality of life. Another way to measure this is quality of life index, which has been pegged at around 65 years for a few decades now. In other words, we're living relatively good lives for 65 years, and then we're pushing the limits of longevity, but most people are seeing a rapid decline of health and quality of life in their last 15 to 25 years. Essentially, this is the distinction between lifespan, how many years will somebody live, versus health span. How many healthy years are we given inside of that longevity? My goal for me in my life and for my patients, and most likely your goal as well, is to close the gap between health span and lifespan. We want to live as many high quality life years as we can before our health starts to decline. And probably most of us would choose a very rapid decline and not a long and painful, drawn out loss of health and quality of life for our remaining 20 years. Recent studies show us that the majority of chronic illness, 75% or more of chronic illness, is preventable and is really based on lifestyle choices and environmental factors more than anything else. And if that research is accurate, we have an incredible amount of influence over what our health span will look like for our remaining years. The one thing I can promise you is that that is not a reactive approach to health. That needs to be a proactive approach to health, meaning if you sit idly by and simply react to different health issues as they pop up, you are not going to increase your health span. But if you're actively looking for ways to improve your health throughout your life, that is the key to closing the gap between health span and lifespan. So it is true that age is the number one risk factor for all chronic illness, but I would argue that that's a correlation, not a causation. Yes, many people, as they age, the wear and tear builds up over time. And I believe that many of us are aging prematurely, that there are other drivers of disease that accumulate as we age. And it's handling the drivers of disease that actually is what closes the gap that we're talking about. Often when I lecture, I talk about the pillars of chronic illness and the hallmarks of aging. Let's talk about those two categories quickly. So this is a slide that I use very frequently when I'm lecturing. These are the pillars of chronic illness, and essentially almost every chronic illness that we can think of will in some way follow this cycle. Just for the sake of this conversation, we're going to start at the top of the circle. And at the top, you can see hypoperfusion. Hypoperfusion essentially means we're getting decreased levels of oxygen to whatever cells or tissues we're talking about. Now, in many cases, that hypoperfusion could be caused by a number of different issues, but with hypoperfusion comes reduced blood flow. As you're having reduced blood flow to a certain cell or tissue, you can no longer deliver the nutrients that you're trying to deliver, and you can no longer get rid of the cellular waste products. If a cell cannot get rid of its own waste products, it's literally sitting and bathing in its own waste. That's where inflammation begins to develop. So we get chronic inflammation as a result. If we cannot get nutrients to that cell, then we can't metabolize our food and create cellular energy. So we get increased in chronic inflammation and we get decreased in cellular metabolism. Once we have cells that can no longer create the energy that they need and they're chronically inflamed, we start to get additional changes in the cell and in the immediate environment of those cells. The immune system starts to get involved, and so we get increased immune response. We get increase in reactive oxygen species, or basically oxidative stress, which also leads to cellular damage. With the immune system dysregulation and the oxidative stress on these cells, we start to get changes in cell signaling between healthy cells and these chronically inflamed cells. And as a result, we get epigenetic changes, cellular damage, tissue damage, inflammation, and then further hypoperfusion, and the cycle continues. If we compare that to some of the hallmarks of aging, you'll see some similar overlap. There's mitochondrial changes, which are also another way of saying metabolic dysfunction. We get epigenetic changes and telomere damage, which is another way of talking about the epigenetic, the DNA, and the cellular damage that's occurring as a result of all of this inflammation. We get altered intracellular communication, cell signaling disruptions, similar to those of the pillars of chronic illness. We get stem cell exhaustion, so basically a reduced ability to heal and regenerate those cells and tissues, which leads to cellular senescence, which are basically cells that are still operating, but they're not operating well. They can no longer divide and they can't repair. Some people talk about this as zombie cells, but they're cells that won't die, and yet they're not healthy, so they're not properly contributing to healthy cellular function. So as you can see, these hallmarks of aging can very quickly lead to the pillars of chronic illness, which, in my opinion, is why aging is the #1 risk factor for chronic illness. For a moment, let's just talk about the mechanisms of action of hyperbaric. If you've spent any time on this channel, we talk about hyperbaric and, meaning we're talking about what we can combine with hyperbaric from a synergistic standpoint to really maximize the impact of whatever we're trying to create for a given patient with a specific health concern. But in this particular video, we're just going to talk about hyperbaric by itself and what impact it has on this entire chain of events that we're talking about. Maybe you just bought your first chamber, or you're thinking about buying your first chamber. Maybe that's a home use chamber, or perhaps you're considering offering hyperbaric inside your clinic. And if you're anything like me when I first started, you're realizing how much information there is out there, and you're concerned, are you doing this the right way? Are you being safe? How am I going to utilize this hyperbaric chamber in the most effective way possible? If you're just getting involved in hyperbarics and you're looking for an introductory training program, the basic hyperbaric technician program is exactly what you need. In this course, we're going to cover how does hyperbaric work? Why does hyperbaric work? What makes hyperbaric oxygen such a unique therapy? What mechanisms of action are taking place? What are the benefits of hyperbaric, both short and long term? And what types of indications are appropriate to utilize hyperbaric for? We will also help build your confidence, not only in how to utilize the therapy, but how to talk about this therapy with patients or with other healthcare providers that may not understand hyperbarics the way you will once you finish this course. So if you're ready to dive in, click the link below this video and let's get started. So here's a number of mechanisms of action of hyperbaric. These are non-controversial and well-studied. Essentially, I feel very confident saying that everybody who goes into a hyperbaric chamber over the right series of sessions in terms of frequency and duration, getting the right amount of oxygen and the right amount of pressure over a period of time, are going to experience virtually all of these mechanisms. We can break these mechanisms of action into 4 categories: mechanical changes, the impact of hyperoxygenation on the cells, the impact that hyperbaric has on our immune system, and the impact that hyperbaric oxygen has on the repair and regenerative mechanisms of our cells and tissues. So these categories are really the ones that we want to focus on when it comes to closing the gap between health span and lifespan. So on this slide, which looks very similar to the first one that we started with, the pillars of chronic illness, I'd like to show you how hyperbaric all by itself literally touches every single one of these pillars of chronic illness. Could we have even better results if we start synergizing with other modalities? Of course. But please take a look and see what hyperbaric alone actually does to reverse that cycle that we were talking about earlier. Let's start again at the top. Where we had hypoperfusion, literally the hyperoxygenation effect of hyperbarics will drive perfusion systemically everywhere inside your body. Whether that hypoperfusion was from tissue damage, inflammation, or toxicity, the oxygen gradient that hyperbaric provides will overcome those barriers to oxygen diffusion, and we will perfuse cells and tissues everywhere inside that body. As we improve perfusion, we're going to improve blood flow. In fact, one of the long-term benefits of hyperbaric is even angiogenesis, or new capillary growth, meaning that after a series of sessions, if there's damaged capillaries, we can build new pathways, new highways to carry blood, so that even when we pull hyperbaric away, we now have capillary beds that are sufficient to continue to oxygenate these cells and tissues long after the hyperbaric sessions have been completed. As we're increasing perfusion and repairing those blood vessels, we're now going to be able to create the highways and pathways to remove cellular waste, which is the byproduct of normal cellular function. We're also going to deliver the nutrients necessary for those cells to do their job and to create energy. So as we restore normal cellular metabolism, we're going to improve energy production and we're going to decrease cellular inflammation almost immediately. That'll lead to a decrease in the immune system's involvement because we're no longer damaged and chronically inflamed. The net effect of long-term hyperbaric exposure is not increased oxidative stress, it's actually decreased oxidative stress. It helps us upregulate the antioxidant system in our body. And so where the pillars of chronic illness had increased reactive oxygen species, the net effect of hyperbarics will be a decrease in reactive oxygen species. Next, we had cell signaling dysfunction. Once we're making the right amount of cellular energy, once we're reducing inflammation and decreasing the immune response and normalizing the amount of reactive oxygen species, we're going to normalize the cell signaling. That'll lead to cellular repair, mitochondrial repair, epigenetic repair, DNA repair, and then cell and tissue repair, which brings us right back up to increased hyperperfusion. So again, literally, hyperbaric on its own, without adding any synergistic modalities or strategies, touches every one of the pillars of chronic illness, reversing the entire cycle. Do I think hyperbaric is the only thing you should do to close the gap between health span and lifespan? Absolutely not. Do I think it's a foundational therapy that almost everybody ought to be using at different phases in their life in order to help close that gap? You better believe it. Just to drive that point home, here's an image from another study that was done recently comparing 51 different longevity strategies. Please keep in mind that this included longevity strategies for healthy people, but it also included longevity strategies for really sick, chronically ill people as well. Inside these strategies, you'll see different supplements, different exercise strategies, different diets, or even different medications and surgical procedures to try to offset especially certain disease processes. All the way at the end here, these were the strategies that were least effective, and on the other end of this continuum are the strategies that were the most effective. The two most effective strategies for longevity really had to do with disease processes. The number 1 and number 2 strategy had to do with taking antiretroviral medications if somebody was diagnosed with HIV. That makes a lot of sense. The next most impactful strategy was taking metformin in somebody with advanced diabetes. If you remove diseases completely, and we talk about moderately healthy people without diabetes and without HIV, the number 1 and number 2 strategy for longevity across all 51 strategies was literally hyperbarics in 2 different phases, in low pressure and in high pressure. And I'm showing you this just to highlight the fact that while hyperbaric should not be done alone, there are a number of different strategies. A lot of the other ones in this study were also critically important, like proper exercise and proper diet. But hyperbaric alone was literally one of the most powerful strategies inside this longevity conversation. In addition to hyperbarics, there are 4 other, what I consider to be foundational components of building long-lasting health. We did another video specifically describing all 5 of the foundations of building long-lasting health, and those 5 components are really what I believe that everybody needs to focus on in order to close that health span to lifespan gap. And you should definitely watch that video next. I'm going to put it right here so that you can click here and go right into the next video, better understanding what those other foundational components are. As always, thanks again for your time and attention, and I'll see you on our next video.